Okay, so the program that I attended is the Diabetes Empowerment Education Program at the Anchorage Senior Center. The class had 6 elderly participants when I was there, and I was able to talk with the program coordinators, Ann Lovejoy and Kathy Colwell. They are the health project managers at the Mountain Pacific Quality Healthcare Center. So the goal of the program is to educate adults with diabetes and provide them with tips on how to manage their diabetes with self-management education. The program is designed to engage the participants with interactive workshops and create a fun and motivating environment to help encourage behavior change in small steps, since diabetes care requires many resources and social support. So the model that applies to this program is actually one that we just talked about, the Freer's model of education. Self-management education is the cornerstone of treatment for all people with diabetes. Since patients are the center of treatment, this form of education helps give them autonomy. Freer believed that education frees people from a culture of silence and can encourage positive social and behavioral changes. An article from the Journal of the Clinical Diabetes titled Empowerment and Self-Management of Diabetes describes how effective and important this type of education program is for helping patients deal with the reality of chronic diabetes care. The article emphasizes that knowing about the illness is not enough, and knowing about a patient's life is important because ultimately they are the decision makers in control of their daily self-management care. The target group that this program addresses are people with type 2 diabetes, low levels of literacy, those who are in need of group support or are encountering barriers to behavioral changes, and are also developing complications with diabetes. So I'm going to talk about each one of these constructs in more detail. The dialogue construct promotes awareness of the facts in the context or social reality. The DEEP program curriculum usually entails 8 to 10 weekly 2-hour sessions conducted by a trained promoter or health educator. The educators assess what short or long-term behavior changes the participants are ready for, and together they come up with weekly goals. They also learn more about the disease and what self-management skills are available. The next phase, conscientization, focuses on enlightening people about the obstacles that prevent them from a clear perception of reality. It is also about coming together as change agents through team-building activities. During the session that I went to, we definitely discussed the obstacles to eating healthy and how we can modify our meals to be healthier and diabetic friendly. We first did an interactive activity where we named our favorite foods and then categorized them into whether they were fats, carbs, or proteins. This was a simple visual way to see the different elements that make up our food. How to properly read nutrition labels was also discussed, and I learned that the amount of carbs a diabetic should have during a meal should be no more than 45 grams. With this in mind, Kathy and Ann printed off recipes that showed what a normal recipe had, the ingredients and the nutrition facts, and then compared it to a diabetic-friendly, modified recipe. The seniors seemed to enjoy this approach and liked seeing how they could still eat their favorite foods with simple modifications. The next construct, praxis, focuses on the link between the source of knowledge and reality. In health education intervention programs, it is used when participants work on a specific project or accomplish tasks. The program acknowledges that the community is a source of knowledge. For example, we all learned from another participant that at Fred Meyer's and many other grocery stores, a nutritionist is usually available at the pharmacy and will happily walk around and show you what foods would be a healthy choice. The next construct, transformation, promotes independence, status, and integrity among the participants. The individuals can become more conscious and aware of the issue that they are learning about. One way that the program uses this construct is every week the group identifies and comes up with specific goals related to unhealthy behaviors. They plan on achieving these goals individually and sharing their accomplishments at the next session. The last construct is one that we talked about last week, and the program evaluators measured this construct by assessing cooperation among group members and the educators, and also how effective the communication was between the two. I think the program fulfilled this criteria for this construct because they provided follow-up visits and phone calls and also facilitated the formation of support groups. So if you guys are interested in being a diabetic educator, the coordinators were asking me if I knew anyone who would be interested in doing this for the program. So they're offering training sessions as well as the program sessions this summer all over Alaska. So I would contact the coordinators if you are interested in doing that. And here are my references. Thank you so much for watching.